Good. Welcome, everybody. I'm Dr. Cliff Smyth from the Department of Mind-Body Medicine in the College of Integrative Medicine and Health Sciences at Saybrook University. And today we'll do a practice with a focus on awareness of our face and make some use of some gentle, mindful movements to help us. So in mindfulness practice, Buddhist mindfulness practice, of course, mindfulness of the body is the first foundation of mindfulness. And your face is a special part of your body. It's one of the main ways that we respond to the world. It has 43 muscles, some of them attached to other muscles and connective tissue, so it offers a lot of flexibility. And it offers flexibility in how we respond and how we express ourselves. For example, how we show that we're listening. And these days, our faces do a lot of work for us as we communicate online, meet online. So let's begin. You might come and sit forward on the chair and have your feet on the floor and feel the support for your sits bones in the chair. Or for this practice, you might be comfortable just scooting your pelvis back. But either way, sitting comfortably tall with a long spine, feeling for that feeling of the head balanced on top of the spine, and noticing that you're breathing. The movements of breathing in the body, and maybe some sensations of the air coming and going at the nostrils or through the mouth or both, and the sensations of the air passing through the throat, sensing for the space at the back of the throat. Now, bring your attention to your face as a whole. And, what do you notice right away? Maybe the temperature of your skin, the air on your skin, or some tension or tiredness someplace in your face. Just notice without judgment. And can you bring your attention to your face without touching it? So let's bring attention to the whole right side of your face now, just noticing. And now, if it's comfortable, do bring the whole of your right hand and gently place it on the side of your right side of your face. Softening the hand, breathing, and have the base of your hand near the jawline and the palm on the cheek and the fingertips near the temple, being careful of the eye, and softening the hand to the shape of your face and feeling the shape of your face, the right side of your face with your right hand, the skin, the temperature, anything that you notice, cradling the right side of your face and gently, with care and interest and without judgment, feeling your face. And then resting your hand in your arm and comparing the sensations in each side of your face. And then the whole left side of your face. First, just bring your attention there, placing your attention in the left side of your face, maybe moving it around. Notice if you use your eyes to help you attend to the left side of the face, even if they're closed. And then again now, taking your left hand, softening the hand, placing it on the left side of your face, the base of the hand near the jaw, the thumb near the ear, the palm on the cheek, the fingertips near the temple, careful with the eye, and just sensing the left side of your face with your left hand, the temperature, the shape, making it very comfortable and sensing without judgment. Good, and then float your left hand and arm down and rest them. And bringing your attention back to the whole face. Now just let your attention alight on your forehead, sensing there. And as we proceed with some movements, I invite you to do them very small, very light, very slow, with the smallest amount of effort. And you can pause anytime you want to and rest between each movement. So now a few times, just very lightly raise the skin and muscles on your forehead, a small amount, like you lifting your eyebrows in interest in something new or in mild surprise, just a few times. Raising the skin, the muscles, the tissues on your forehead, and then relaxing them. Make it very small, very comfortable, and just do it 3 or 4 or 5 times. Raising the tissues and then releasing the work in between each movement. Go slow and then rest. Good, and leave the attention to the forehead now and bring your attention to both your eyes. And maybe you can get a sense of the weight of your eyes sitting in the sockets. Often one eye feels a little heavier or a little bigger. Just noticing without judgment. And maybe you can sense the light touch of your eyelids on your eye. Breathing, of course. And now really going gently, just gently but clearly squeeze both eyes a little bit and then unsqueeze them. Use the eyelids and the muscles in the orbits of the eyes to press a little on your eyes. Don't do anything that's uncomfortable, even slightly headachy. Be very gentle with your eyes, gently squeezing and unsqueezing, and then taking a breath or two. Each time resting in between. 3 or 4 or 5 times, slowly squeezing both eyes, noticing if there's any difference, and then unsqueezing and resting. Breathing softly and evenly. Good. Pause a moment. And now a few times, just squeeze the right eye, just a little bit. There might be a little bunching up of the skin and the muscles. And then you really soften. Just do the right eye 2 or 3 times. Really softening all around the eye after you squeeze. And then a few times, say 3 times, squeeze the left eye. Again, noticing if there's any differences with the right. And softening around the eye each time you unsqueeze. Good, and then squeeze both eyes again a couple of times. And then unsqueeze. And then rest again, comparing the feeling in your eyes and the feeling in your whole face. And now bring your attention to both cheeks. Does one seem more full? Does one feel softer or tighter? And then a small number of times, just see if it's possible to softly draw your right cheek to the right. And let the corner of your mouth follow as if you're making a little dimple. And see if it's possible to comfortably let the jaw also go to the right with the cheek and the mouth. And then, of course, bring it back and pause a moment and do that a small number of times to the right. Doing only what's very comfortable and very small. Relaxing your face between each movement. Good. And then pause a moment. And now pull your left cheek gently to the left, letting the corner of the mouth move comfortably with the cheek, and let the lower jaw slide a little bit. Only if it's comfortable. Don't do anything uncomfortable. And is it different taking your cheek and your mouth and your jaw a little to the left than the right? Good. And pausing, sensing your whole face. Readjust your sitting a little bit if you need to. Notice that you're breathing. Good. A few times now, just let your jaw pop open just a tiny bit. So your teeth and lips just separate a little bit. You might moisten your lips with your tongue and then make a little kissing noise as your mouth opens, like you are blowing a quiet kiss to a baby, a little kind of sound. Just letting the jaw swing open a little bit, not pulling it down. Just let it open a little bit. So your mouth's making a movement, a small movement like a guppy. Do it a few times, only if you can do it without any effort or any discomfort. Gently bringing the lips together and letting the mouth open again, softening the jaw. Good, and leave that a moment. And a couple of times now, find out if it's possible, just a couple of times, to think of taking all the skin and all the tissues of your face a little bit to the right. The forehead, the eyes turn to the right to help. There might be some activation at the temple on the right, and the cheek and the mouth and the jaw also all glide to the right a little bit. And then come back to the middle. You might feel a little pulling in the scalp, the back of the head, the ear, but going very gently. And you can always imagine it. You could always imagine that you could do it if it's hard to find. It's just a tiny movement of drawing all of the tissues of your face a little to the right. And then pause. And then a few times, gently drawing the tissues of your face to the left. The forehead, the corner of the eyes turn left. The cheek, and the corner of the mouth, the left corner of the mouth, and the jaw. Breathing, making it very simple. Good, good. And leave that be, and sensing your whole face now, the temperature, the tonus, the feeling. Make sure you're breathing. And now I invite you to remember or imagine a kindly act, something caring that someone has done towards you, for you, or something that you've done for someone, maybe a child or a pet. And can I invite you just to gently bring forth a smile? Give it a moment for the smile to emerge, but find out if a gentle smile is available to you. And maybe there's a sigh that goes with it. Just letting a smile emerge on your face if that works for you right now. And maybe the smile feeling might also go to your heart space. And then to finish now, if you found any softness or warmth or comfort in your face, just imagine that could flow down through your neck and your throat, down into your shoulders and your chest, softening, warming, sinking down from the softness of your face, down your arms, your torso, your pelvis, your legs, all the way to the feet, from the face to the feet, imagining, softening, and easing. And then leaving the practice now, and inviting you to take any new awareness of your face, any ease you found in your face into your day, knowing that with awareness we can make an appropriate response to the world and to our own feelings. Good. Slowly coming back to being in the room to the extent that you want, putting on your camera or not, recognizing that people may have been in a deep place. And thank you. That's our practice for today.